Today's topic is going to be about the well talked about decompression sickness. Decompression sickness. Let's first start off with the definition. Decompression sickness is a disease that occurs when the body is exposed to a decrease in ambient pressure enough to cause dissolved gases to leave solution and form bubbles. So let me make that shorter. Bubble formation. Due to a rapid change in ambient pressure. So ambient pressure, that just means the pressure in our environment. While watching this video right now, we're exposed to pressure of 760 millimeters of mercury. So that's an example. The pressure we're feeling right now at surface. So let's just take a step back and look at respiratory. So follow my pointer, please. So we take in air, right, through our mouths, and the air goes down our trachea, splits into our two bronchi. From there, it goes into bronchioles. You can see these bronchioles right here. I mentioned it in my pulmonary edema video. And at the end of these bronchioles, you'll see our tiny alveoli, microscopic alveoli that we can't see with the naked eye. So if we look to our right, I zoomed in on a capillary, on a drawn capillary. A drawn alveoli. So once that air goes down our trachea, down our bronchi, bronchioles, it then enters our alveoli. And in this alveoli is air, right? Because we're breathing air. Now what's in air? The major component of air is nitrogen, 79%, and oxygen, 21%. And here's our capillaries. Oxygen diffuses in to the capillary, and CO2 diffuses out of the capillary. Now, why does oxygen diffuse into our blood? It diffuses into our blood because it has an affinity for hemoglobin. As we know, hemoglobin is what transports oxygen in our blood. So if we have nitrogen diffusing into our blood because it has it wants to bind to hemoglobin, then where does the nitrogen go? And let me draw the nitrogen right here. I'll draw one right here, right there, and right there. Where does it go? And the answer is because nitrogen doesn't have a true purpose in our bodies. The nitrogen essentially just gets breathed out. So the air comes in, and all the oxygens come into the capillaries, into our blood, and the CO2 comes out. And the nitrogen, these just get breathed out back into the environment. Now it's important to mention that a small amount of nitrogen does diffuse into the blood. It doesn't attach to the red blood cell. It's in our plasma. And let me draw an example of that right now. So here's an example of a capillary or any blood vessel that you want to imagine. And you have red blood cells right there, red blood cells. And you have white blood cells, and a white blood cell. So what else is in blood besides red blood cells and white blood cells? There's plasma. And plasma is the fluid in the blood. What makes the blood fluid-like is the plasma. And in our plasma, there's hormones, there's enzymes, but There's also nitrogen, because nitrogen doesn't want to go to the red blood cell, it doesn't want to go to the white blood cell, so it's just, I'll draw this out right now. Let's see if I can, right there, there's nitrogen, there's some nitrogen, and maybe put some nitrogen over there. So it's just floating in our plasma. So I added another picture, a more detailed picture. So right here you see the alveolus again. You see the oxygen come into the blood, the CO2 come out, and then the nitrogen is floating in the blood vessel now. So then where does that small amount of nitrogen go next? Well, let's follow the arrow. It goes to the cells and the tissues with oxygen. So we see the cell right here, and tissues are made up of millions of cells. So the oxygen is not an inert gas. We've all heard that nitrogen is an inert gas, correct? Oxygen is not. It has a chemical reaction with something. So oxygen goes into the cell, and it undergoes cellular respiration, and then the cell uses the O2, and CO2 is the byproduct. So O2 comes in, the cell uses it, gives us energy so we can live, and CO2 comes out. Nitrogen does diffuse into the cell, but nothing happens. It comes into the cell, the tissue, and then it comes out. And because we're on surface here, we're at an equilibrium. Our bodies are content. So the amount of nitrogen entering the cell is equal to the amount of nitrogen exiting the cell. So it keeps that 1-to-1 ratio. Hey cell, I'm gonna give you a nitrogen, and the cell goes, okay, but first let me release a nitrogen, and that's how we maintain equilibrium. So this topic is very important in regards to Henry's law. Henry's law is the law of absorption, and it relates to decompression sickness heavily. So what Henry's law states is that, and follow my pointer, when a gas comes in contact with a liquid, so we see here a gas, we have oxygen in an airspace. When it comes in contact with a liquid, the liquids are blood, gas molecules move out of solution into the gas phase and move from the gas phase into solution within the liquid phase. So what this is saying is similar to what I previously said. When one gas of oxygen moves into the blood, which is a solution, an equal amount of oxygen will move from the liquid back to the gas. So gas to liquid, liquid to gas. Let me just write that. So gas to liquid is equal to liquid to gas. And because our bodies want to always maintain a state of equilibrium, it always wants to be balanced. So the amount of gas will be equal to the amount of the gas in solution. So at 1 ATAs, we have 1, 2, 3, 4, 5, 6 gas molecules. And then in the solution, which is the liquid, so pretend it's blood, we have 1, 2, 3, 4, 5, 6. Again, at 2 ATAs, we have more gas molecules, but it's equal to the amount of gas in the solution. in the blood. This next piece of information is very crucial. The greater the partial pressure of a gas, the greater amount of that gas will dissolve into solution. So the more we make that gas, the higher partial pressure of a gas. So let's say we're diving, right? We go to 33 feet. We're now at 2 ATAs. That partial pressure of that gas is higher, which means, according to Henry's law, the amount of that gas that will dissolve into our blood will be higher. So I'm going to have more nitrogen dissolve into the blood. Remember, before at surface we have a small amount, but now that we're at 33 feet or 66 feet or 130 feet, we're going to have a lot more nitrogen dissolving in. Let's look at this picture right here. You can see it, what I just explained. Right here, we have, let's say at surface, there's not very much molecules in the solution. But as we increase our pressure, see we're increasing the pressure, the more molecules are dissolved into that solution, which is our blood. So let's look at one more example. I'll give you guys a real-world example that I'm sure has been explained in the past, but I'll just go over it again. So let's take a soda bottle, right? A soda is very carbonated, which means there's a lot of CO2, and when I shake that bottle, or I don't even have to shake it, there's just more CO2 in that bottle. There's more CO2 in this bottle than there is out here. You see all these CO2s? CO2, CO2, and then there's not very many out here, right? But if I shake it, I increase the pressure. So I have all this CO2 rising to the top of this bottle, but I have a cork, or I have the cap on the bottle. So it can't escape, but it wants to. The CO2 wants to be equal to the CO2 in the atmosphere, but I can't. It's closed off. So it's all gathering right there. And as soon as I remove this cap, I'm going to have all the CO2 jump out. It wants to be equal with the environment. It wants to be happy. You can kind of observe that right here in that diagram. So I shook the soda bottle, I increased our partial pressure of that gas, and now I'm going to have a greater amount of gas dissolve into solution, or the atmosphere as my example right here. And eventually, if I leave this cap open overnight, eventually the CO2 in the drink will be equal with the environment. And that's why your sodas become flat. They become flat because they've now reached equilibrium with the environment. So if you want to keep a tastier drink, I would put the cap back on when, in between sips. Now in Henry's law, temperature is constant. But if we decrease the temperature, if we're diving in colder waters, the more gas will be dissolved in solution. So that's why when you're diving in cold water, you're at a higher risk for decompression sickness, because the colder the temperature, the lower the temperature, the more gas that will be absorbed. Now, what if I shake the bottle, right, and I increase the partial pressure of that CO2 in the bottle, but I release the cap very slowly. So I'm going to just erase half of it. So I take the cap and I gently crack it, and I hear that hiss, and I slowly crack it until the hissing stops. Then that's an example of everyday life when we're diving. We dive and we increase the partial pressure, and we have nitrogen dissolved into our blood, but we follow proper ascent rates. We come up slowly in the water column so that the nitrogen can slowly hiss out of our tissues, our blood, and make its way back out the lungs. But if I just shake this bottle and I just rip that cap off, I'm going to have CO2 or nitrogen just rushing out of solution. When we're making a slow ascent, the nitrogen in our tissues or in our blood dissolves into our tissues, and it comes out of the tissue into the blood, still in dissolved form, and it makes its way to the lungs where we can breathe it out. But if we shoot to the surface and we don't get an AGE, then bubbles are going to form, because that hiss, it's not going to be a hiss, it's going to be, think of not an explosion, but it needs to recreate that equilibrium. It says, hey, we need to make that equilibrium, so let's go. It goes in, so that dissolved nitrogen comes out of solution and into the gas phase, so that it can reach equilibrium faster. And that's what decompression sickness is. It's a disease that occurs when the body is exposed to a rapid decrease in ambient pressure, sufficiently enough to cause dissolved gases to leave the solution, to leave the blood, and form bubbles. Think about this. Excess nitrogen in your tissue can only leave by only two ways. There's only two ways nitrogen can leave our tissues. Number one, removal of the gas, of the nitrogen, by the lungs in dissolved form. So this is saying how we breathe in oxygen and it gets dissolved into our blood, and then CO2 comes out and we breathe it out in dissolved form. That's what it's talking about. Or by diffusion into the bubble, causing bubble growth. So that excess nitrogen can diffuse out of the tissue into the bubble, causing bubble growth. And it will keep growing this bubble until equilibrium is met. The tissue, the nitrogen in the tissue, wants to be the same as the nitrogen in that bubble in the blood. So now that we have our diver and he has bubbles, a bubble formation in his blood, and we have him on surface, let's talk about treatment. And I'll do a separate video on how bubbles affect our blood vessels, commonly known as the secondary bubble effect. I'll do that in a separate video. But let's look at our treatment basics relating to the physiology of decompression sickness. So, number one, we compress our diver to 60 feet, right? That's our first thing we do when we get in a chamber, is we go to 60 feet. 60 feet has a higher pressure. Higher pressure. which means, according to Boyle's law, the volume will go down. So I would have my bubble on surface, and when I go to 60 feet, it will be that big, or even smaller. The bubble gets compressed to 37% of its original size. Well, now let's look at how this is related to Henry's law. If I increased my pressure, that means I increased the partial pressure of all those gases. So now I have a higher partial pressure of nitrogen, of the 21% oxygen in the air. I now have a higher partial pressure of that, and then that means, according to Henry's law, I'm going to have more diffusion of nitrogen into the tissues. And we don't want that. Our problem in the first place was absorption of nitrogen to the tissues, and we're trying to eliminate that. So what we do is we always give 100% oxygen. So we can just eliminate the nitrogen, and we can get a higher partial pressure of oxygen going into our blood, and oxygen heals. But the main reason we use oxygen is to eliminate essentially Henry's law in regards to nitrogen. Nitrogen elimination from the tissue increases, and the bubble resolves rapidly by direct removal of the nitrogen from the bubble to the tissue to the lungs. The bubble, when it gets smaller, when the volume gets smaller to that 37% of its original size, it doesn't just go to the lungs. The tissue has to absorb that nitrogen again. So I have bubble to tissue to lung.